Good morning, and today I am going to provide you with this update on the state of affairs in Pennsylvania. And again, I'm focusing on Pennsylvania because this is where I live. Plus, we seem to be doing a really good job in our state relative to states where the governors allowed for early opening and didn't require mask wearing. In Pennsylvania, we're obligated to wear a mask the moment we leave our house. So, unless of course one is engaged in some solitary outdoor activity or a sport where you have social distancing is possible, you have to wear a mask, particularly when you're indoors. So I love it because it takes the decision out of the people's hands because we can't trust people, unfortunately. It's just the way it goes. So I'm at the Pennsylvania site here, as you can see, pa.gov, going to their coronavirus site. And this is just a look at what the situation is right now in Pennsylvania. This is cases. You can see there overall there's like an upswing right now in cases. Deaths remain low going into July. This is what we want to see. We want to see deaths, and we want to see a continuing decline in cases as well. Now you can see, wait a minute, there's an increase in cases here. Yes, so we're having this quadratic shape here where you're going down and up. But hopefully this up won't be too far up. That's what I'm hoping for. So what I want to do is I want to analyze what this all looks like. And this is an important figure here because it actually breaks down the cases into different regions of the state. So I live in the area that's most populated, which is the southeastern part of Pennsylvania. Now, if you include Philadelphia, we had a lot of protests in Philadelphia, and we, of course, are opening up again. Basically, what you can see here is the protests really added nothing more than a spike, but it really didn't do anything in terms of causing a large number of new cases, and that's good news. In this area, you can see there is a little bit of an upswing, but it's also still going down considerably from where we were in April. It seems like right now, when we looked at the last picture and we saw that there was this increase, it looks like it's driven primarily by what's happening in southwestern Pennsylvania. So I can't explain that. I don't live there, but it's that group that's driving the overall picture. I'm not talking about this because this picture is actually broken down by region, but the overall, like the average change that we see in Pennsylvania. Let's look at the death reports. This is obviously very important because what we want to do is we want to prevent death. I mean, imagine if everybody got infected by the coronavirus, but nobody died. Would anybody care? I think people only care because they're afraid of ending up in hospitals and respirators and dying. I mean, nobody wants that. So let's take a look at what's going on in terms of deaths. The sex difference does nothing for me. This is interesting here still, because 21% of all deaths are among African Americans. And you say, well, wait a minute, whites are still dying more, of course, but they also make up a larger proportion of the population. African Americans make up 12% of the population in Pennsylvania, yet this is 21% of all deaths, so that's disproportionate. So you always have to look at things in terms of proportions of the population. Hispanics are dying at a low rate, but this also could be because of the way people define Hispanic ethnicity. But this is, if you're Hispanics, good news in the sense that there's less deaths in that group than in others. Now let's look at the age breakdown, and this again is critical because if we are opening up, we have to open up because our economy depends on it. It's how we respond to the opening up that's important, and that's what the key message here is. Very few, these asterisks here are less than 5 deaths in this area, so it says those counts are suppressed because they're so small, and it's in a sense it's hard to account for everything in these figures. 79% of all deaths occurred in individuals 70 or above. 79%. Think about that. If we add 65 and above, because we always talk about 65 is this magical threshold for what makes it dangerous to be around COVID-19, it accounts for 87% of all deaths. So that means 13% of all deaths occurred among individuals 64 and below. So that's a major disparity. So we can see where the deaths are, and this tells us why we have to protect our elderly, right? So we can't just assume that, oh, everything's okay if I don't wear my mask, I'm cool, I'm not going to die. Well, maybe you won't, and maybe you'll just get it and be fine. But what about your loved ones? That's the group I'm concerned about. In terms of where deaths occurred, I'm not going to talk about hospitals because people go to hospitals and they have to, and we don't know who those individuals are. But if we look at long-term care, which is your nursing home and hospices where people go when they're terminally ill, if we add those two together, that accounts for 46% of all deaths from COVID-19. And in terms of comorbidities, so comorbidities, these are other conditions that one have at the time of death. It says at the time of reporting, approximately 30% of death records did not have comorbid data. So the majority of people, right, 63%, have some kind of comorbidity. The main two are dementia, which is probably because people are quite old in the nursing homes, hypertension, high blood pressure, diabetes, chronic obstructive pulmonary disease, so lung conditions, right? And then, of course, heart disease. So you can see that what the key issues are among individuals who have died. There's one more area that I want to look at. So this wasn't something that I was think of in advance, but I just thought about it now. Let's look at hospital preparedness. So this tells us what we have available to us in case we have a major condition. So there's 97 COVID-19 patients on ventilator. It's better, okay. On CMOs, 5 total ventilators in use, 1,071. So this means that some of the ventilators, actually the majority of the ventilators, are used by non-COVID patients. So this is important because a lot of times you'll see people reporting data, but they won't tell you what the data they're reporting are. Like if they said, oh no, we are using 1071 of all ventilators, and people will assume, who are listening, or the audience will assume that's COVID patients. But it's not, because it says here that you have 97 COVID patients on ventilators. Or if the hospital beds are starting to be used a lot, say it's all because of COVID. Well, it's 589 COVID patients. So be wise in the way you read the data. And I'll end it right there. Thank you for spending your morning with me.